Mayberry and Gertie here to talk about the foot, which is, of course, our last installment of the lower limb discussion. Okay, so we can start by looking at an articulated foot. Okay, so this is your heel. This is within your ankle. We'll tell you what bones those are in a second. So the calcaneus is your heel. If you've heard of your calcaneal tendon, that's your Achilles tendon. That is coming down your calf and inserting here in the calcaneus. On top of the calcaneus is your talus. So the talus is, these are plastic, the talus is between your tibia and your fibula. Okay, so that is within your ankle. The talus looks like a little turtle. It's adorable. Calcaneus and talus. Next, if you look at the articulated foot, this is the calcaneus, that's the talus. This is the navicular that articulates with the head of the talus. We say that the navicular, I'm about to get creepy and weird, the navicular looks like a little monocle. Okay, so if you don't have to side this in my class, but if you did, it rests on your nose like that. It's a little monocle. It's got this single articular facet here. That's the navicular. The cuboid is the bone that actually articulates with the head of the calcaneus. So this is the cuboid. This is the cuboid. Some people don't like the tarsal bones because they aren't as distinctive, I guess you could say, as the carpals. Oh well, you still have to know them. Cuboid, okay? Then I grouped the next three together. They're all cuneiforms. There's medial, intermediate, and lateral, which is quite convenient. They are named as with the anatomical position. So your big toe is, of course, medial. So medial, intermediate, lateral, cuneiforms. If you look at them like as you were to look down at your foot, they sort of look like pieces of pie or cake. Okay? So in a straight up osteo class, you would have to know the differences. You'd probably have to be able to side them even, but you don't in this forensic course. You do have to be able to know what they are. So those are the tarsals. There are only 7, which is not the same as your wrist because, of course, there are 8 bones in your wrist, the carpals. So realize that. So 7 tarsals. Then, of course, we have the metatarsals. So tarsals, metatarsals that are sort of the body of your foot, and then into the phalanges. The phalanges, your toes are shorter than your fingers, so the phalanges on your feet are slightly shorter than the ones in your hands. So very similar to your metacarpals. The metatarsal has this rounded distal articular facet, which means that the proximal phalanx, that first most proximal of the phalanges in each digit, has one rounded facet there. Just like with your thumb, your big toe does not have an intermediate phalanx, it just has the distal, but the other 4 digits do have intermediates. The intermediate phalanx on the foot is this stubby little thing, whereas on your finger, it's this whole knuckle here. So it's actually this super tiny little thing here, not to be confused with the distal phalanx, because like the distal phalanx of your fingers, this looks like it has that little fingernail type, well, toenail in this instance, area. Though this is funky looking, and I can see that you would think that, this one does not have that. So it is, you can see it articulated in here. It is very tiny, but it still does articulate with that distal phalanx. Sometimes you actually see fusion in older individuals, especially if they've suffered trauma to their toes, which, you know, probably all of us have stubbed our toe at least once. If you're me, many, many, many times in your life. If it's particularly bad, you can cause this, which we'll talk more about when we talk about pathology. So that is the foot, and that wraps up our lower limb. So we'll make some more videos later, and I will post videos about the rest of the body, mainly the vertebral column, the ribs, the skull, which will follow along with the rest of your landmark lists. So be sure that you have taken your notes and you bring in your forms to get credit in class, and be sure to bring any questions to me. See you in class.